ileum and jejun. You know, here we have the greater intestine. It is descending colon. Descending colon, it is going to be continued by the colon sigmoid. Colon sigmoid is going to be continued by the rectum. You know, the descending colon, the position is retroperitoneal. The colon sigmoid have meso. We call the mesocolon sigmoid. This mesocolon sigmoid permit to you to move the colon sigmoid into the right and left side, okay? We remove all of the peritoneum. So one of the structure that we remove here is peritoneum. We remove the peritoneum. We can show you some of the vessel in posterior wall of the abdomen as abdominal aorta, vena cava inferior. Vena cava inferior is the largest vein in our body here, and it is the abdominal aorta. Abdominal aorta, it is coming down at the level of the L4. It is going to divide to two branches, the right common iliac artery and left common iliac artery. Each of them L4. Never forget, at the level of L4, the abdominal aorta divide to right and left common iliac artery. Each of them come down, and anterior to sacroiliac joint, it is going there in each side are going to divide to two branches, internal iliac, external iliac. Internal iliac, external iliac. Here, the left common iliac vein, right common iliac vein join to each other at the level of L5, make the vena cava inferior. So the left common iliac artery, left common iliac vein, right common iliac artery, right common iliac vein. The external iliac, it is going to move the external iliac here. It is going to move and leave the pelvic cavity. Before leaving the pelvic cavity, here again, the external iliac is leaving the pelvic cavity. Before leaving the pelvic cavity, have two branches. One of the branch is visible here. The name is inferior epigastric artery. Inferior epigastric artery accompanied to the inferior epigastric vein. Here, the fold of the peritoneum over the inferior epigastric vessel we call lateral umbilical fold. So lateral umbilical fold is the fold of peritoneum over the inferior epigastric vessel. Inferior epigastric vessel, inferior epigastric artery is one of the branch that arise from the external iliac in the pelvic cavity. Before leaving the pelvic cavity, the external iliac artery pass posterior behind of the inguinal ligament and enter to the thigh. The name changed to femoral artery. Femoral artery is continue of external iliac after passing behind of the inguinal ligament. Here you have to find some muscle in posterior wall of the abdomen. One of them is easy, and you know, psoas major. Another muscle here is iliacus. Another muscle is quadratus lumbarum. Quadratus lumbarum, iliacus, and psoas major. Here I can explain and show you the lumbar plexus. It is a nervous system, just some part of the somatic nervous system, lumbar plexus. Lumbar plexus is going to be four, and then some of the terminal branch that here is visible. We can show you the ilioinguinal, iliohypogastric, ilioinguinal, lateral cutaneous nerve of thigh. So iliohypogastric, ilioinguinal, and lateral cutaneous nerve of thigh. Psoas major, lateral to psoas major, I can show you femoral nerve. Anterior to psoas major, here is better. Anterior to psoas major, I can show you the genitofemoral. So anterior to psoas major, genitofemoral. Lateral to psoas major, femoral nerve. Medial to psoas major, here is visible. You can find the obturator nerve. It is obturator nerve in this pancet, this forceps. You can find the obturator nerve. Obturator nerve medial to psoas major, femoral nerve lateral to psoas major, anterior to psoas major. Here is better, genitofemoral, and again iliohypogastric, ilioinguinal, lateral cutaneous nerve of thigh. Here is also easy. Look at here. iliohypogastric, ilioinguinal, lateral cutaneous nerve of thigh, femoral, genitofemoral, and here the obturator nerve. Okay? All of this you are going to be asked in the exam from this part. Now, in the pelvic cavity, this belongs to the woman, so we can show you two peritoneal pouch. One of them is anterior to the uterus and posterior to urinary bladder. This pouch, it is not very deep. The name is vesicouterine pouch. Vesicouterine pouch. Another pouch that it is important and it is deep, it is posterior to uterus. Uterus posterior to uterus, anterior to the rectum. Here we can find another deep pouch. What's the name of this deep pouch in women? Douglas. Rectouterine pouch or Douglas pouch. You know the colon sigmoid is here. The terminal coil of the ileum you can find here. All of this item, all of this structure are going to occupy the Douglas pouch or rectouterine pouch. Uterus, here fallopian tube or uterine tube, and here laterally you can find the ovary. Ovary and the distal end or the lateral end of the ovary uterine tube. This structure in women you can find anterior to internal iliac artery. Where is internal iliac? Look at here. It is external iliac and this is internal iliac. Anterior to internal iliac. First, peritoneum will remove. Another item in the woman, ovary and distal end or lateral end of the fallopian tube. Distal end or lateral end of fallopian tube, ovary and peritoneum. These structures are visible anterior to the internal iliac. Another structure here. Look at here. I am going to show you the ureter. This is the ureter. Ureter is passing just posterior to intersigmoid recess. Where is intersigmoid recess? You know the mesocolon sigmoid have two roots. Lateral root, medial root. This lateral and medial or internal and external, this junction is here. Here is intersigmoid recess and the left ureter is passing just posterior to the intersigmoid recess. It is very important. You have to know the left ureter is passing posterior to intersigmoid recess. Now the ureter is going to enter to the pelvic cavity. It is going to enter to the urinary bladder from posterior surface. Posterior surface of urinary bladder, this ureter is going to connect to the urinary bladder. Now here, another structure that you can find anterior to internal iliac is ureter. So in the woman, ureter, ovary, lateral end of the fallopian tube, and the peritoneum. All these structures are anterior to the internal iliac artery. The external iliac is here, internal iliac is here. External iliac have one branch that we call inferior epigastric. The internal iliac is here. We have some branch, but in the another cutoff we are going to show you all of the branch.